Hello, everyone, and welcome to our Cancer Focus Week. This week, we have so many incredible guests who are sharing information that I really feel like we need to scream from the rooftops. And today, my guest is Dr. Randy Ringold, and he is the founder and everything that goes along with VDI Labs. And I have been a fan of VDI Labs, which is a veterinary diagnostic lab, since I was in practice. So I don't remember when they first started. He can give us that information, but I have used their tests and I think that the results are impeccable and give us so much information and treatment options. It's not just, well, here's your test result, good luck, go away. You get actionable steps to go along with it. So Dr. Ringold, thank you so much for
It's a pleasure to be here. Thank you for inviting me.
So give us a little bit of the history of VDI Labs and what your background is and how you got this whole thing going.
Oh, well, it was kind of like everything, it wasn't intended.
Yep.
Yeah, I mean, I have a long history. I'm a clinical chemist by training. I've been doing this for a lot of years on the human side. Almost all my experience has been on the human side. Big, long stint at Quest Diagnostics. Everybody should be aware of who they are. I worked in the esoteric division of it, senior level officer there, all specialty type tests. And, I had an opportunity to get into the veterinary space. When I started looking at veterinary space, I realized that there wasn't a whole lot of esoteric tests. You had CBCs and chemistries, and that was kind of about it. And on the human side, there was like all sorts of different kinds of, special tests to, have the tool set that clinicians need to make diagnoses. And so we started in 2006. We had a cardiac marker, NT-proBNP. Many people might know it as CardioPET. We sold it to IDEX. And then from there, we moved on to other inflammatory diseases. Cardiac disease is certainly an inflammatory disease, but I like the whole area of inflammatory diseases. And there's so many of them. Cancer was a particular focus for us, of interest to me personally. And so after the cardiac marker, we decided to assemble a series of effective cancer markers in the veterinary space, and led us to just keep growing and growing this whole portfolio that we have, which is really quite large now.
And it is multiplying. It's like you've hit a tipping point and now it's just like rolling downhill. There's like more tests, which is amazing. And a lot of them are bundled in test kits. So it's not like you have to get 20 different blood draws. You can get one blood draw, one test kit, and get a ton of answers. That's not to say that you might need a couple of different test kits depending on what you're doing. So I'm going to bring in, because we've talked about my little guy a couple times this week in our cancer discussions. So I have a 15-and-a-half-year-old English toy spaniel, and I practice traditional Chinese veterinary medicine. So one of the things we use for that is tongue diagnosis. And so this little guy, his tongue turned what I call toxic red. It was a dark, deep red. Some days it almost looked black. It was so bad. And I was like, oh, you got something bad somewhere, honey. I don't know where it is. So of course, what do? We do a CBC chem, just like you said. Perfectly normal. Oh, that's great. Thank you so much. Yeah. And he's got mitral valve disease. So we do his echocardiogram. Yeah, no changes there. We do abdominal x-ray. All looks good. And I'm like, there's something going on. I do a urinalysis. It's normal. I'm like, there's something going on. I know there's something going on. So we ended up getting an abdominal ultrasound and found out that his cancer is in his bladder, which not a lot of markers for that. There is the cadet BRAF urine test, and we did that, and it did come back positive for TCC. But one of the things that I know from experience is that our cancer patients so commonly have, some dysbiosis, maybe a little leaky gut, vitamin D that's low, some, their B vitamins. So one of the first things I did is I did one of your test kits, and he did come back, even though he was on vitamin D supplement, he still came back low at 47.9.
That's really low.
All right, well, yeah. And that's all in supplementation. So I'm like, all right, well, your gut is clearly not changing things around. Maybe we've got a little leaky gut. He also came back low normal on his B12. I'm like, okay. And he was on a tiny bit of supplement. Well, now we're on a lot more supplementation because we want to bring those up because we know that's a cancer problem. But interestingly, on his test, and you and I were discussing this before we went live. And so I want you to explain this to people because when it came back to me, I had to laugh. But I'm not doing chemo or radiation or surgery on my dog. I am using everything that I know from a holistic standpoint. And so his inflammation marker, his CRP, came back optimal at 0.5, and optimal is anything less than 2. So that's really good. He doesn't have a lot of inflammation or much at all. And his cancer risk came back very low at 2.1. And I had to laugh because I'm like, well, okay, he doesn't have a cancer risk, but he has cancer. So I need you to tell everyone why his test looks like that with what I'm doing with him right now.
Well, first of all, anytime I see a CRP that's below 2, while it is optimal, it's often suppressed. So when it gets below 1, it usually means there's some kind of medication that's being done. And if you didn't, while the types of therapies that you're using are maybe not, quote, traditional, doesn't mean they're not effective. I mean,
right.
We service a lot of the holistic and integrative veterinary community, and I see all these different types of medications all the time. And they are quite effective in reducing the inflammatory response and even in many cases, proliferation. There's a lot of good anti-proliferative medications as well to help reduce the cellular turnover of cancer. And so when we assemble the markers that we have, which you talked about CRP, that's one of them, which is an inflammatory marker. The other one is thymidine kinase type 1. It's a DNA proliferation marker that makes the nucleotide thymidine, but through a abnormal cell growth mechanism. So it becomes sort of a cancer marker, but it's a growth marker of cancer. So if you are suppressing successfully the growth of the cancer, then the TK value will drop. And
so his TK1 came back equivocal at 5.3.
Okay, so it's not completely back to normal, but you've suppressed the inflammatory situation. And what we tell people is that you need to monitor the TK1 signal, particularly to see if it trends up, because it'll be the first one that actually spikes before inflammation spikes in a recurrence of cancer.
Interesting.
Yeah.
How often would you retest that?
Depends on the type of cancer. If it's usually around a 4 to 6 week window.
Okay.
If it's an aggressive cancer, 4 weeks. If it's more of an indolent, slow type cancer, you could go as long as 8. But anything beyond 8, you're just sort of recording history at that point.
Oh, my little guy's going to need blood then. Okay. I'm learning here. This is great. So yeah, I love that we can kind of monitor how we're doing with our therapies, or is this cancer getting ahead of us? Even if you're using traditional treatments, chemotherapy, radiation, whatever, this could be used to monitor that, correct?
Yeah, absolutely. Yes. Because we're not measuring the actual rate of proliferation of the tumor itself. However it's affected. If you're suppressing it, you're suppressing it. It doesn't matter what the medication is. If the medication is successful in suppressing it, we're measuring it because we're measuring tumor turnover is what we're doing. So
awesome.
Yeah, it works really well.
Very cool. All right. And I also did folate, and that came out normal, and his cobalamin was low normal. So I'm like, all right, well, your guts are doing some things. We're just not making those vitamin D conversions that we need to make. So up in our game on that. Another one of your tests that I did, and it's not necessarily related to cancer, but I think if you had things that were really out of whack, and this was a new test that I didn't even know you had, the hair mineral analysis.
Mm-hmm.
Is that one fairly new? It
is. It's a new area that we've gotten into. The reason why we got into it is, so we've been doing vitamin D for a long time. We do a lot of vitamin D tests. And it's something I'm very passionate about. I brought up the vitamin D test at Quest Diagnostics decades ago. And it's huge on the human side, and it's becoming very large on the companion animal side. But then we also brought in magnesium. Magnesium is an important element. It's the cofactor for a lot of enzymatic reactions, including vitamin D, but also for a lot of hormones. To be able to function, you need to have magnesium. But one of the problems is when you're measuring serum magnesium, which is part of a lot of chem panels, it could be normal, but your body store is still low because most of the storage of magnesium is in the cell. And so we said, well, how can we measure magnesium and other essential elements at the cellular level, not at the serum level, which is under endocrine control? And then that's what we came up with, sort of, let's just do it from the hair because it's coming straight from the cell. The composition is going to reflect what's going on in the cell, and then you get a whole bunch of minerals and everything, including toxic elements like mercury and lead. So it works really nice, and it's a better metric.
Yeah. So, and I was very happy when I got that back. Everything was perfectly normal range for my little guy. I'm like, okay, that means we're feeding a clean diet, which I was pretty sure we were. All my dogs are raw fed, by the way, sometimes gently cooked, but, and I was hoping we had a clean environment, but this is further proof that we do. Now you also have specific tests for, GI lymphosarcoma.
Yes.
And so that is one of the things. Is that test goes for dogs and cats, right?
Yeah, dogs and cats. It doesn't matter. We've got it work for both.
So part of the problem, if we have an animal that's got these chronic GI symptoms, vomiting, diarrhea, loose stools, mucoid stools, whatever it is, and we do an ultrasound, it's like, oh, we have thickening of the bowel. If you don't see an actual tumor, it's like, well, it might be IBD, it might be PLE, it might be lymphangiectasia, or it might be lymphosarcoma.
Right. Yeah. So it's a complicated disease, as you well know. And ultrasound is really valuable. I mean, we highly recommend it, but as you just indicated, it doesn't always tell you everything you need to know. So you can do biopsy, but biopsy is invasive and costly, and some senior cats or dogs may not be good to go under anesthesia. So what can you do? Well, we assembled a series of markers. We have an advanced GI panel that has 12 of them. And now we can differentiate IBD, lymphoma, pancreatitis, protein-losing enteropathy, malabsorption, SIBO, a wide variety of things from the blood by looking at the relationships of all these different markers. And it's a really effective panel, which we're continuing to add to it because it's a complex disease. That's the issue.
Well, sure. And for a lot of these animals, they've got this GI inflammation, no matter what the cause is. And then we get leaky gut, and then we get allergies. Okay. And you recently came out with, again, an allergy panel.
Yeah. Well, because allergies can be the root cause for inflammatory bowel disease. And chronic inflammatory bowel disease can lead to intestinal lymphoma. It's a cascading effect. I mean, we just came out with glyphosate testing, which is, Roundup, because that can also do the same thing. So the issue is you can treat the disease, but if you don't start stepping back a little bit and looking at the cause of what led you to that in the first place, these are chronic disorders. They're not acute. Right. It's not like you're getting hit by a car or something,
Right.
So you've got to figure it out, and it's a puzzle. And we're trying to put the pieces together to help the veterinarian figure out for the pet parent what is really going on with this pet so that you can solve the problem.
Well, and is your glyphosate test, is that urine or blood?
It's urine and fur. We have both.
Oh, cool.
So
all right. I'll have to do that too then. Okay.
They're both, they measure a little bit different, but it'll still tell you about exposure.
Okay. So some of these tests, obviously we want the pet owner to work with their veterinarian, but things like the fur mineral analysis, anybody could send that in. A urine test, anybody could send that in.
Right.
A blood test, you need somebody to draw the blood, spin it down, and put it in the little wells. But the test kits are so simple to use. And it's funny because we've had some veterinarians that clients will bring it in and they're like, I don't know how to use this. I'm not going to do it. And I'm like, really?
It's really simple.
Because they're so simple to use. Like I used to just have my technicians do all the, get the blood draw, spin it down, do it. And it's changed because when I just did this one, it used to be like a little, it was almost like a coffee filter with the little dots. Yes. And now you've got the little wells.
Yes. So
have they all gone to that?
Yeah, the whole thing. Everything's now the little wells. We don't use the spot saver card is what we used to call them. There's a nice history to that thing. That little spot saver card was developed back in the 1960s for for PKU. When I was at UCLA many years ago, used to do heel sticks for infants looking for PKU. And that was done on spot savers, dried blood. And it's been around for a long time, but it doesn't work well with things like vitamin D or hormones or enzymes or things like that. So we developed that device that you're referring to, which is took a long time to get it into that format, but it allows for this blood stabilization in a dry format. So, I mean, here we're in California, and we get samples from all over the U.S., Canada, Korea, Europe, Australia, Japan, all in our little dried kit, because it's really great. It works very stable.
It is really simple to use. Like, I was impressed that, get a blood sample, spin it down, and take that serum, and you give exact measurements, like you need this much, put it in here, seal it in the little foil pouch, put it in the mailer, and off it goes. I mean, it's
no ice,
it is
no nothing.
Yeah. Don't have to freeze my samples. Really easy.
With the lab, I'm saying, it's like, because it comes like in a little envelope. It's like we get our love letters from all over the world. It's like open them up.
Well, and it is great that this literally can be done from anywhere in the world, because there are a lot of areas in the world where they don't have access to the bigger labs. They don't have access to a lot of these tests that you have developed.
That's true. I mean, they're specialty tests. And, most of the veterinary community takes human tests and converts them over to veterinary tests. And so when we develop stuff, we developed it very specifically for veterinary application. And not only for just veterinary, there's a huge difference between cats and dogs. Cats are their own enigma. They require everything different. Let me tell you.
Right. So let's talk about that a little bit, because for the cats, you have the haptoglobin, the HPT, and the CRP for dogs.
That's right.
What's the difference between the two?
Well, they're acute phase proteins. Humans have CRP. We also have haptoglobin, but there's something called a major and minor acute phase reactant. All it means is that what is the main protein that is being generated by your liver in response to an inflammatory stimuli. And for humans and dogs, it's CRP. And a cat and horses, it's haptoglobin. It's just evolution has changed a little bit on how they respond. And so we use those markers appropriately.
So if someone wanted to be really proactive, if they have a breed that is prone to cancer, or they have a dog who the genetic line, maybe there's been other animals in that line that have had cancer issues. At what age do you think we need to start monitoring some of these markers?
Well, for most cats and dogs, I think 5 years and older, you should be monitoring a lot of this stuff regularly. Although I tell people for vitamin D, 1-2 years old and on, if you really want to get into disease prevention. So we talk about, diagnosing disease, but we don't really spend a whole lot of time talking about disease prevention. And they're really quite different things. The question is what can we do for our patients, for our loved ones, is in terms of helping them prevent from having these problems in the first place. And there are certain things. Vitamin D is a huge one, by the way, since it's so involved in the innate immune system, that you need to really make certain that it's sufficient. And these are the ones that should be done earlier. But the other markers, like for cancer, we have a degenerative joint disease marker. We did talk about that. We measure hyaluronic acid in the bloodstream, which is an early marker of degenerative joint disease, which you can do something. You can't really fix it, but you can slow its progression with various types of treatments, right? And so these are the things that I think are important, that if we can catch things early enough or prevent them from happening in the first place, we're making their life better. And I think that's really what everybody wants to do in the first place.
Absolutely. I mean, if we could cut inflammation off in its path because we know that it's happening early, why would we not want to do that?
Yes.
And I mean, we do know that chronic inflammation is going to lead to cancer. You have chronic irritation, inflammation in a certain area.
It's going to happen.
It's the cells sooner or later are going to say, I just give up. I can't anymore. And so, I mean, I don't know why my little dog has bladder cancer. We haven't figured that out yet. I am going to do the glyphosate test, although I've had him most of his life and we haven't used it, but you never know.
Right.
Let's find out.
You can pick it up, by the way, from grass and park.
Yeah, sure. Yeah. So my dogs lead a pretty close lifestyle, but you just don't know. And so getting that information is pretty critical so that you know, do I have to try to detox this? Do I need to have to, how am I going to deal with these things? So for me, I'm just a huge fan of testing. That's when I was in practice, it was not about vaccinations. It was not about selling chemicals and drugs. It was always about what can I do preventatively and what do I need to be monitoring with lab work. I'm like the lab work queen. I would drain your dog dry running lab tests because I love the information. I just like the information. So I love this. Now, let's say there are veterinarians watching or people who want to go to their veterinarian and say, I'd like to be proactive and do some of this testing. Where does their veterinarian go, or what do they take to them to say, hey, check this out?
Well, a number of different ways of doing this. Signing up with us is easy. Getting our kits are easy. A veterinarian can just go to vdilab.com and sign up. We have certain outlets for prepaid test kits that they can buy and then turn around and take it to the veterinarian and get them to just put the blood in the little device that we have and send it to us and done. It's very, very quick.
It is so simple. It does not cost the veterinarian anything to sign up
zero.
An account.
No, nothing.
Zero to sign up for an account. They may never use it, but I'm telling you, once they start using it and they start seeing what they get, I think a lot of it is they're afraid they're going to get results and then they don't know how to interpret it or what to do with it because they haven't heard of a CRP or a haptoglobin or a TK1, except you guys explain all that.
Yeah,
when you get the report, it's explained.
I do consults every single day to provide guidance on how to interpret a result, or even if a patient may be appropriate. Not every patient is appropriate for this or that. And then if they have a question, they can call and ask, and I'll tell them whether or not that's a good decision or no, do this or something else. But there's so many different diagnostic tests that are out there that just running CBCs and chemistries, and that's the only thing you do, is sad. I'm sorry, it's sad.
It is. Well, like my little guy, everything is perfectly normal, except for his brick red tongue.
I'll just say one thing is that the body works really hard to keep serum as stable as possible, and then we use that
absolutely
to try to see if something's abnormal or not. Well, how many times do you see an abnormal or a sick patient? You run chemistries and they come back normal. All the time. So it's not a. I don't say not do them. I'm just saying it's not enough.
It's not enough. I can't tell you how many animals would come in, big dogs, middle to late age. Their only symptom is his eyeballs are red, like red eyes. And I look at these dogs and I look at their tongue and do their pulse and stuff from my TCVM standpoint. And 9 times out of 10, unless they just had a simple conjunctivitis, 9 times out of 10, they're lymphoma dogs. And the only thing they're showing me is red eyes, and their lab work comes back perfectly normal.
Yes, it's so common.
And when I can add on some of these inflammatory markers and some of these other tests and say, yeah, I knew there was more. My gut just tells me there's more. Like with my dog, I know there's more going on. I have to go find it.
I always tell my clients is that if you could only run one test, just one on a perfectly normal dog, what would you run? And I would tell them run the inflammatory marker, because a normal dog, human too, should not have inflammation if everything's okay. Should not.
There you go.
Right?
So you get a positive inflammatory marker, then you better be chasing something down.
Figure out why. That's right.
Yep. So whether that's changing diet, changing supplements, changing environment, whatever, but it means chase it down,
That's
find
correct.
it, and
That's
fix
right.
it. So, I mean, I love what you guys are doing. It's funny. I get the VDI emails and it's sort of like, oh my gosh, another new test. And I'm like, this is so awesome. So, you know, at some point you're going to have this one kit that has like 75 different tests in it. And I'll be the first one in line.
Oh, bless you.
No, I love this stuff. To me, it's sort of like putting a puzzle together. It's like a logic
That's
puzzle.
why I like it.
It's like,
that's what I like to do. It's like, to me, it's like a challenge and try to figure out how can we get to the answer as fast as possible. And that's why we put together the services that we do. And we just keep working it. That's all.
Absolutely. Absolutely. Well, I love what you do. Thank you. Thank you for you're one of those sciencey or science people, like we like to say, which is great because somebody has to be that person because I'm not. I'm happy to use your test kits. I don't have to know exactly how they work. So I appreciate you. I appreciate your company. Your company is easy to deal with. They've been wonderful over the years to me, to my patients, to my clients. And so I really appreciate what you guys are doing. And I can't wait to see what comes out next.
There'll be more. Trust me.
There'll be more. He's not done yet, which is good for us and great for our pets. And I'm going to draw my guy's blood every 4 to 6 weeks and make sure my anti-inflammatory protocol is working for him. This is exciting. Now I have a better knowledge on interpreting that in general. So that is great. And then that helps me help other people. So Dr. Ringold, thank you so much for all that you do. Thank you for your company. Thank you for giving us your time today. And really appreciate it. I'm going to go see what else is new on your website, vdilab.com, folks.